Have you ever been sitting in a burnout prevention meeting or somebody's talking about burnout and you're thinking to yourself, what I feel all those things, but I don't know how to fix it. And I've done all of the trainings and I've taken personal time and I've done all the things and I still feel the same way. I still feel like I'm letting my patients down. Like I can't keep up. Like it's burying me. And you're thinking, maybe it's me. Maybe all these other doctors have it figured out. And maybe I'm the problem. But I'm here to tell you, it's not you. It is the system that has been constructed to make you think that. That's gaslighting at its core, making you think that what you're feeling is not true or real. And that is a problem. And that's been going on for physicians across the nation. And everybody is having that nagging feeling in the pit of their stomach going, gosh, maybe it's me. Maybe if I just, did a little bit better. Maybe if I buckled down and worked a little bit harder. Maybe if I stayed after work a little bit longer, I could get my notes done. Maybe if I could, be smarter, nicer, what have you, maybe that would work. And I don't think it's you. I know it's not you. Every doctor is feeling this. And we've been told that it's us. And so we're hiding this dirty little secret that maybe it's us, and I'm feeling this way and I'm feeling like a failure and I'm feeling like I just can't get my job done. Look around you. Everybody's feeling that way and everybody's ashamed to feel that way because at our core, we have been programmed to succeed and put ourselves on the back burner and not take care of ourselves and just work and work and work. And if you put your head down and if you work hard enough, then maybe you can succeed. Maybe you can achieve this lofty goal of being the selfless physician that gets all of their notes done on time, perfectly constructed. And that's not reality. We're humans and we need to take care of ourselves because we haven't been taught how to do that. So, what is moral injury in healthcare? Let me tell you, it's not just some abstract concept. It's a vicious reality many of us face every single day. We hear a lot about burnout, right? Everyone is talking about how doctors are overworked and exhausted. But let's get real. Blaming burnout on us is a gross oversimplification. It's not just the heavy workload or the long hours, it's a much deeper issue. It's far more insidious. It's a moral injury to our character, and it's infuriating. Picture this. You're juggling a dozen patients, each one needing your undivided attention. You know exactly what each one needs, but you're forced to cut corners. You're forced to rush through the care, to make decisions that gnaw at your conscience because of the constraints and the bureaucratic nonsense. You're told you can't give the care that you need to give to your patient because of insurance or red tape or hoops that you haven't jumped through. We're not just talking about fatigue. It's the gut-wrenching, soul-crushing distress that comes when you cannot give your patients the care they deserve. And it's the care you swore to provide. It's knowing that despite your best efforts, the system is rigged against you and rigged against your patients. This narrative that we're simply just burnt out and we need some rest is not only misleading, it's an insult. It ignores the true depth of the problem. We're constantly forced into these situations where we have to compromise our values, and it shreds our mental health and it erodes our integrity. And this just isn't bad for us. It is catastrophic for our patients. And this is what we need to call it what it is. It's moral injury, and it needs to be addressed head on. Our well-being and future of our healthcare and our patients depend on it. It's one of those things that when you're a child, and if you're told you're a bad kid enough times, you start to believe it. And then you start to act it. And then it makes you question your actual character and who you are. And that's what's happening across the nation in physicians, is they're now questioning, like, am I a good doctor? I don't know. Like, I'm told I'm a bad doctor every day because I didn't check the boxes. I didn't get my charts done. I didn't do the things that the system needed me to do to get paid. And so then I'm told I'm a bad doctor. And the patients think I'm a bad doctor because I can only spend 7 minutes with them and I didn't actually help them. But I'm not a bad doctor. I just can't perform good doctoring in the system as it is designed. We don't have the time. We don't have the resources. I don't have the ability to do the job how I know best how to do it. So what causes moral injury in healthcare? It's infuriatingly clear. Our suffering isn't just a matter of individual stress. It's a systemic failure. We're talking about the crushing burden of inadequate resources. If you've ever been told, no, we can't give you an MA, no, we can't give you a scribe, that's moral injury. The mind-numbing maze of administrative tasks where you can't click the boxes, you can't delegate to your nurse, you have to click the boxes yourself for some unknown reason. That's moral injury. And the endless bureaucratic red tape that chokes our every move. No, you can't prescribe this medication because it's not on formulary. No, you can't give this brace because it's not on formulary. No, you can't do this for your patient because the insurance company hasn't approved it. That's moral injury. We are forced to jump through the hoops to make decisions on financial constraints, not our own, but the insurance company's financial constraints. And we are then told that this is the best care when they haven't gone to medical school, they haven't known their patient, and they're telling us this is best for them. No, this is best for their pocketbook. This is not best for the patient. And that's moral injury. When you have these things where you are told, oh, they didn't approve it, you're going to need to do a peer-to-peer review, and peer-to-peer, right? Are these really your peers? Do they actually know how you treat your patients? No. And so this is a war of attrition. It has been clear that the insurance companies, by default, deny everything. And then it's up to you to jump through this hoop and that hoop and this hoop and that hoop. And it's a war of attrition, right? If you can just hold out long enough, you can just do enough to get the care approved, they finally give in and approve. But they're betting that 8 out of 10 won't do it, or can't do it, or don't have enough resources to continually jump through these hoops. That's moral injury. If you have experienced any of these things, you're not suffering from burnout. You're suffering from moral injury, where it's pulling at your heartstrings because you know what the right thing is to do, and you know your patient and what they will benefit from, and you're being told you can't give it to them. And that puts you in the crosshairs. That puts you not on the same team as your patient, but on an opposing team. And that erodes that doctor-patient relationship, that sacred relationship where they know you're doing everything that you've sworn to do to take care of them. And that is being eroded by this third-party intervention telling you what you can and cannot do. There's a movement right now for direct care. There's direct primary care, there's direct specialty care, and these are things that I'm monitoring and talking, and all of that. These are things that are happening right now, and it's everybody stepping outside of the system and saying, no, I'm not going to do it anymore. I'm going to do it on my terms. I'm going to care for my patients on my terms and their terms, and nobody can insert themselves in the middle of our relationship. Nobody should be able to tell me how I best care for my patient that I know, and they're coming to me for care. Why is it that we get to somehow allow that relationship to be intruded upon. That's not okay. And so for all the physicians who are stepping outside the system, and we're naming these things, it's called direct care, meaning direct to the patient from the doctor care. And there is a movement called direct primary care, DPC, and there's a movement called direct specialty care for surgical specialties, oncology, endocrinology. All of the specialty physicians now are also recognizing that the system does not work for them and it doesn't work for their patients. And so we're stepping outside that system to be able to care directly for our patients. Now, when you're thinking about how do you even start, how do you even make this practice a reality, and you've been told maybe you need to check with your lawyer and your accountant, which is good advice. The problem is that if your lawyer is not a direct care lawyer and your lawyer is a healthcare lawyer, you have to understand where they're coming from, what their training is, and are they giving you good advice? Are they giving you sound advice, or are they giving you advice that is mired in the current reality of the insurance-based system? And so if they are stuck in the mindset that you have to comply with all the insurances and you don't take insurance and you're not enrolled in insurance and you're not part of a government payer, then the advice that they are giving you may not apply and may be not good advice. And it's not because they're being malicious, they're just not understanding the difference between insurance-based care and direct care. And so when you're looking for a lawyer to help you with the construction of your LLC or medical corporation, definitely start to look for those healthcare lawyers who specialize in direct care for construction. And I think that will give you much more sound advice regarding Stark violation, regarding HIPAA violation, regarding all the things. I know that I have been given bad advice as well. I've had a lawyer that's a healthcare lawyer, not expertise in direct care, and I had a healthcare lawyer that had expertise in direct primary care, and she was able to give us really sound advice for what we did and did not need, what was important, what did not pertain to us. And so I would just urge you, when you're looking and you're like, oh, you need to call your lawyer, make sure that that advice is coming from a sound place. The things that are scary, that are a reality for being scary, is you don't know what to do and you don't even know where to look or what resources to do. And then there's lots of people giving you, I don't want to say bad advice, but it's like Chicken Little, and they're like, oh, you can't do that, you're gonna get HIPAA. Oh, you can't do that, that's a Stark violation. Oh, you can't do that, that's an anti-kickback law. Oh, you can't do this, that, or the other. And it's like, okay, let's just stop. Yes, you can. We're doctors, we can care for patients. It's not illegal for doctors to care for patients outside a big medical insurance-based health system. It's just not. And so everyone's mindset is such that it's somehow illegal for doctors to care for patients directly. And I think that's part of the fear that we work through every day. When people say that the healthcare system is broken, I tell them, no. And they get kind of upset. But the healthcare system is performing in the way that it was designed to make money for the stakeholders. Unfortunately, this was not designed to improve care for patients, improve working environment for the doctors, solidify and advance the doctor-patient relationship. It was not designed to do that. It was designed in direct opposition to that sacred bond. It's a system problem. It's not a person problem. And the system is functioning in the way it was designed. It's making a lot of money. If you look at all of the CEOs of the major insurance carriers, they are having record years to make money. And they're making money on the backs of the physicians and the patients. They're taking the patient's money, keeping the money, denying care, and blaming the doctor. This cannot continue. And I am absolutely, because this is my why. I was so fed up that I was like, I don't care, I'm quitting medicine. I cannot tolerate this 1 second more. I can't do it. It was untenable for me to be able to continue doing medicine like that. And so I finally, and it was scary. It was so scary. But I was like, I'm not well. I can't continue this. I'm not the person I want to be. I'm not the doctor I want to be. I cannot continue practicing medicine in this fashion. And I quit. And I actually wasn't planning on practicing medicine at all. And I got dragged back into it, but it helped me construct the way I practice medicine now, which is completely different and fulfilling. And I take good care of patients. It's like a 180, and you just have to step outside the system. When I quit, I hadn't really thought it through. Obviously, it was a rash decision, and I just walked out because I just couldn't take one more second of it, and I was losing my mind. And then, coming back, I didn't even have a plan. My office girls constructed a plan of like, oh goodness, how are we going to keep our jobs? And how are we going to serve our patients? And so they came up with a way for me to be able to step back into medicine at a significantly lower exposure or volume or all of those things, and only do the things that I could tolerate. And it was 2 half days in the morning and 1 day of surgery. and I was like, okay, I could probably do that. Okay, let's do just that. And so the things that was scary, number one, I thought I was going to go broke for sure. Turns out I did not. And cutting my schedule in half, literally in half, by 50%, only decreased my revenue by 1/3. So I still had 2/3 of my revenue, which means I was being quite inefficient for a lot of it. And then we closed my practice to new patients, and I thought, oh my gosh, I'm never going to have a new patient again, and the practice is going to close and we're going to go broke. And that wasn't true. Our practice was closed to new patients for 9 months. If you were a new patient, you could not get in. We were just closed. I know that's unheard of in orthopedics, but I had a lot of patients that I was taking care of, and we sometimes may get exceptions for like their spouse or, word of mouth things. But otherwise, and then I was still taking calls, so only the call patients could get in, and that was just because I had to do that. And then cutting surgery from 2 days a week to 1 day a week, I thought, I'm going to lose my skills. I'm going to be a bad surgeon. I'm not going to know what to do. And that definitely wasn't true. You don't lose your skills just because you stop operating from X volume to Y volume. So the things that, as we worked through, that was the first step, is just decreasing the onslaught and giving me some breathing room to figure out the next steps. And you do have to have that breathing room to start to figure out in what direction you're going to go. How are you going to actually break free? How are you actually going to give yourself the space to be able to take care of your patients the way that you know is the right way to do it? And so for me, that was finding Orthobiologics and doing training and setting up the cash practice side. And there was really no template, and I basically fumbled along, and I found some resources and did these things, and it continued to work, much to my shock. I was very surprised to find that when you asked for money for a service, they would just pay you. And that was really surprising. I was like, oh, okay. I am valuable. This is happening. You do want my service and you're willing to pay for it. And so I think that definitely is a mindset thing where we've been beat down for so long that we don't even think what we do is valuable or important or amazing. And then when you're on the other side of it and you give really good care to a patient and they really like it and they're happy to pay for it. They're like, oh my gosh, this is the best thing. I haven't had care like this ever. It not only boosts your morale, it's like, hey, I am a good doctor and you're willing to pay me for it? Holy cow, this is amazing. Because for all of that, you are always taught that if you don't do it the way that the health system wants you to, you're gonna get fired, you're gonna lose money. And that is a reality right now. There is a rash of physicians who are becoming non-renewed, meaning they're not getting fired, but they're just not having a job. And so the health systems are calling this non-renewal, oh, we're just not renewing your contract. Oh, you can still practice medicine, you just can't practice medicine here and we won't pay you for it. And you're like, well, now what? Now what do I do? I know some physicians in my program who have had that happen to them. And it was such a shock to one day come to work and be like, oh, by the way, yeah, you don't have a job in 60 days, 90 days. And then what? We've never had that experience to like pull your bootstraps up and be like, okay, well, I'm just gonna like hang a shingle, because people aren't doing that anymore. And so there's not a good template on how to put your office together and just care for patients in a system outside the insurance system, outside of the healthcare, the big healthcare systems, and just directly care for patients. That used to be done. Back in the day, that's how it was done. You hung a shingle, Dr. So-and-so, and the patient would come in, and they'd have a problem, and then you'd fix it, and then they'd pay you. As we go back to that, we have to kind of dive in and figure out those things. Now, I've figured it out, and I can help my colleagues along the way with a much more streamlined approach where we can get you up and running very quickly to be able to care for patients in the nature you see fit.